As C-sections become more and more common around the world, there's a rare but incredibly serious complication that's also on the rise. Today, we're diving into a hidden risk that anyone who's had a C-section needs to know about, the Cesarean Scar Pregnancy. So let's break down what that actually is. So what in the world is a Cesarean Scar Pregnancy, or a CSP? Well, it's a type of ectopic pregnancy, but instead of implanting in the fallopian tube, the embryo attaches itself right into the scar tissue from a prior C-section. Think about it like this. A seed is trying to grow on hard, rocky ground instead of in the rich soil of the uterus. It's just a fundamentally dangerous place for a pregnancy to start.
And this isn't just some obscure medical factoid. It's a real and growing risk. And if it's not caught early, the consequences can be life-altering. So, how common are we talking about here? The estimates are about 1 in every 1,800 pregnancies for those who've had a C-section. Now, I know that might sound pretty rare, but think about how common C-sections are globally. The actual number of these cases is going up, and that makes spotting them early more important than ever.
And the stakes? They couldn't be higher. If a diagnosis is delayed, it can be absolutely catastrophic. That scar tissue just wasn't built to stretch and support a growing pregnancy. It can lead to the uterus rupturing and massive, life-threatening bleeding. In the worst-case scenarios, the only option is an emergency hysterectomy, which means a permanent loss of fertility.
That level of danger is exactly why researchers are desperately searching for better, earlier ways to diagnose CSE. The whole challenge is finding a reliable clue before it becomes a 5-alarm emergency. And that brings us right to the heart of this research.
Right now, the gold standard for diagnosis is an ultrasound. But honestly, it's not always easy. An early CSP can look like other things, so it can be missed. That got scientists thinking, could there be a simpler way? What if a basic blood test, just by looking for signs of inflammation, could give us an early warning? It would be cheap, easy to do, and so much more accessible.
The whole idea was that an embryo implanting in the wrong place, in that scar tissue, would set off the body's alarm bells and trigger inflammation. So researchers decided to look at the key players in our immune system. You've got neutrophils, they're like the first responders, lymphocytes, they're the managers that control the response, and monocytes, they're the cleanup crew. The question was simple. Would the levels of these cells be different in a CSP versus a normal pregnancy?
And that is exactly what this study set out to discover. The researchers took blood samples from 42 patients with CSP and 44 with normal pregnancies to see if they could decode these inflammatory signals.
Okay, so here's the first result that had everyone buzzing. Take a look at this table. Both the monocyte count and the monocyte-to-lymphocyte ratio were significantly higher in the CSP group. See those p-values there? In science, anything under 0.05 is the magic number that suggests your result is really unlikely to be just a random fluke. This looked like a genuine signal.
And this chart just makes that finding pop. It's crystal clear. On average, the monocyte level was definitely higher in the Cesarean Scar Pregnancy group. For a minute there, it really looked like they'd found it, a simple, powerful clue hiding in a routine blood test. It was incredibly promising.
But this is science, and it's all about rigorous testing. Just when it seemed like a huge breakthrough was on the horizon, the story took a really unexpected but totally crucial scientific twist.
Which led to the one question that mattered. Could this simple blood test really be the answer for reliably diagnosing this incredibly dangerous condition?
The answer, after they dug a little deeper, was a clear no. Not promising signal, it turned out to be misleading.
So what happened? Well, the researchers did what all good scientists do. They looked for other explanations. And they noticed something interesting. The CSPs in their study had been diagnosed, on average, a little earlier than the normal pregnancies. And when they adjusted their math to account for that difference in gestational age, poof! The statistical significance vanished. The signal was just noise. The difference they saw wasn't because of the CSP itself, but because of a completely different factor.
And this twist leads us to the final and honestly the most important conclusion from all this research. It basically reaffirms what doctors need to be doing right now to keep patients safe.
The study's own conclusion says it all. Ultrasonography is an indispensable diagnostic method in the diagnosis of CSP. The hunt for a shortcut didn't pan out, which just reinforces how vital that gold standard really is.
So what's the big takeaway from all this? First, there is no simple blood test shortcut for diagnosing CSP, at least not yet.
And that means for anyone with a previous C-section, getting an early, high-quality ultrasound is just absolutely critical. Awareness, for both patients and their doctors, is truly the key to catching this early. And finally, this whole story is a perfect example of science in action. A really promising idea was chased down, tested hard, and in the end shown not to be the answer. And that's a good thing. It prevents a misleading test from ever being used on patients.
You know, we're always hoping for those simple, fast solutions in medicine. But this is such a powerful reminder of the careful, meticulous work it takes to separate a real breakthrough from just a false hope. It really leaves you with a big question. How many other promising medical shortcuts out there are still waiting for their own scientific twist?